Hello everyone, now let us discuss about 2023 CPT coding guidelines for case management services. Coming to case management services, case management is a process in which a physician or another qualified healthcare professional is responsible for direct care of the patient and additionally for coordinating, managing access to, initiating and or supervising other healthcare services needed by the patient. And medical team conferences comes under case management services. And the medical team conferences can be categorized into two types. The medical team conferences which have direct contact with patient and family. The next is the medical team conferences which do not have direct contact with patient and family. With the direct contact and without direct contact with patient and family. Coming to the medical team conferences include face-to-face participation by a minimum of three qualified healthcare professionals from different specialities or disciplines, each of whom provide direct care to the patient with or without the presence of patient, family members, community agencies, surrogate decision maker, etc. And the participants are actively involved in the development, revision, coordination and implementation of healthcare services needed by the patient. And reporting participants shall have performed. The members which are participating in the team conference, the reporting participants shall have performed face-to-face evaluations or treatment of the patient, independent of any team conference within the previous 60 days. And the physicians or other qualified healthcare professionals who may report the E&M services should report their time spent in the team conference with the patient and or family or caregiver present using the E&M codes. And these introductory guidelines regarding the medical team conferences do not apply to services reported using the E&M codes. For that, we need to refer the E&M service guidelines. However, the individual must be directly involved with the patient, providing face-to-face services outside of the conference visit with other physicians and qualified healthcare professionals or agencies. And the reporting participants shall document their participation in the team conference as well as their contributed information and subsequent treatment recommendation. And no more than one individual from the same specialty may report these services. The individual must be of different specialty and no more than one individual from the same specialty may report 99366 and 99368 at the same encounter. That is, two individuals belonging to the same specialty cannot report these codes during the same encounter. There should be one individual from one specialty. Individuals should not report these codes when their participation in the medical team conference is a part of a facility or organizational services contractually provided by organization or facility. In that case also you cannot report these medical team conferences. And the team conferences starts at the beginning of the review of an individual patient and ends at the conclusion of the review. And time related to record keeping and report generation is not reported. The time related to record keeping and report generation is not reported. The reporting participant shall be present for all time reported. And the time reported is not limited to the time that the participant is communicating to the other team members or patient or family or caregiver. And the time reported for medical team conferences may not be used in the determination of time for other services. This is important. The time reported for medical team conferences may not be used in the determination of time for other services such as care plan oversight, that are 99374 to 380, prolonged services which come under the category 99358 and 359, psychotherapy or any E&M service. For team conferences where the patient is present for any part of the duration of the conference, the non-physician or qualified healthcare professionals, for example, speech language pathologist, physical therapist, occupational therapist, social workers or dietitians, they report the team conference face-to-face code. That is 99366 for the team conference where the patient is present for any part of the duration. Even the non-qualified healthcare professionals can report the team conference face-to-face code. That is 99366. Now coming to the CPTs, the first one is medical team conference direct, that is face-to-face contact with patient and or family. The CPT is 99366. The description is medical team conference with interdisciplinary team of healthcare professionals. Face-to-face with patient or family, 30 minutes or more. Participation by non-physician qualified healthcare professional. Now coming to medical team conference without direct contact with patient or family. There are two CPTs, 99367 and 368. The major difference is 99367 deals with medical team conference with interdisciplinary team of healthcare professionals, patient and or family not present, 30 minutes or more, participation by physician. In order to report 99367, physician must be participating. And in order to report 99368, participation by non-physician qualified healthcare professional. Whenever non-physician is participating in the non-face-to-face team conference, you can report 99368. And whenever physician is participating 30 minutes or more in the non-face-to-face without direct contact with the patient or family team conference, then you can report 99367. Now let us see an example. A patient is in the hospital after wedge resection of left lung cancer. He has not been able to keep the lung inflated without a ventilator. A 45-minute team conference between the general surgeon who performed the surgery, a pulmonologist and oncologist and a neurologist is held to discuss the best treatment for the patient. The patient and or family is not present. What CPTs are to be reported here? Here, the patient and the family is not present. That is non-face-to-face, without direct contact. Physicians are discussing. So, the appropriate CPT is 99367. And the total time is 45 minutes. So, the CPT is 99367. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.